Hi, everyone. This is Jessica Puro with Crisis Services, and I'm coming to you with another version of our behind the scenes at Crisis Services during the COVID-19 pandemic. And I'm excited to have with me today Sarah, who's one of our mobile outreach counselors, to share a little bit about her experience and the stories that they're seeing as we go through this community crisis at this time. So, Sarah, thank you so much for spending a little time with me to share your voice of the crisis services experience. Um, so the first thing I think would be great is if you could just share a little bit about what mobile outreach does for the community.
Okay. Um, so I'm Sarah. I'm one of the mobile outreach counselors from Crisis Services, and we do a lot of things, but the common thread in what we're doing is that we're out in the community trying to engage people around mental health, particularly if they're experiencing any kind of mental health symptoms that they think are actually impairing their ability to function on a daily basis, affecting their quality of life. That's when we really want to get involved, go to where they are, meet them where they're at, and have a brief conversational evaluation about how they think they're doing overall. And if there are any resources in the community that we could kind of help get them linked up with that could help them just improve their daily experience.
Yeah. And I think what's been interesting as we've been going through this is that your services really, we haven't seen a dip in the requests for mobile outreach at all. People are still utilizing and accessing the services. So, can you talk a little bit about, you guys are in a bit of a blended model now. You're one of our staff that is working remotely, but you also are still responding out in the community when there's high risk potential cases that you need to do interventions with. So can you talk a little bit about what the remote setup looks like for mobile right now and how you and your teammates have been adapting to that?
Yeah, it's been a big shift, I think, because we are a large team. We are multiple social workers, clinical mental health counselors, people from diverse backgrounds, but we all typically work in a big communal office where we have a lot of communication, a lot of teamwork, and we share all of our cases. That's always been our model. And as of now, what we're doing is converting to a lot of digital remote field work. We do have a couple staff people in our typical headquarters area, but many counselors like myself are at home. This is my office. There are throw pillows. I have my lamp, my curtains, and I have access digitally to all of our cases and my coworkers. So I'm here at home monitoring our workflow. And when there are urgent cases that really need an in-person evaluation, then I brief on those at home, get in my car. Another colleague will get in their car and we coordinate kind of meeting on site just to be there for whoever needs us at that moment. And afterward, we're right back in our offices and doing whatever possible at home.
Right, right. And how has that been for you guys? I know that you have a lot of safety precautions in place as you're going out in the community. How has that been, that experience? Especially to how have clients, have they responded differently to needing to wear masks or, those protective measures? Like, what has that been looking like for you and the work that you do?
That has been an ongoing conversation with our clients because we understand that this is a very cautious time and people want to take every precaution necessary for their health. We want to protect our health and not have any negative effect on the people that we're trying to assist. So we've changed our typical more casual approach, and we're now wearing masks. We have gloves, Purell. We offer these things to clients as well whenever we're engaging with them, just so that we're taking every precaution necessary to ensure that there's no collateral negative outcomes that come out of these evaluations. And typically clients are very understanding of that and still feel that it's necessary to engage with us, even though it could be considered an additional risk at this time. But we do everything possible to minimize that risk and we're only going out to speak to people in person if there's identifiable cause that it's absolutely necessary.
Right. And I think that's really, you guys have done an amazing job of, like, over the past 5 to 6 weeks now, as we've adapted to this routine, is also evaluating how the cases are coming in and the triaging of your cases and how to maintain safety and what can be done over the phone, what could eventually
Mhm.
be done in this kind of like telehealth model, and then what really does require an in-person visit. And I know you guys have been very diligent about really evaluating those components for the cases that are coming in. So thank you for all that, because that's a lot to manage while there's, this community stress going on. Um, what are some things that you think would be helpful for the community to know about mobile outreach, that are, what you do, and maybe what are the things that maybe people expect us to be doing that we can't? So maybe kind of the do's and don'ts a little bit of the mobile outreach services.
Yeah, it's very sensitive to a lot of people when they're initially contacting us because for themselves or for a loved one, they have a high degree of concern and anxiety about how things are going. When people are reaching out to us, we want them to understand that we're going to explore every option necessary to reach out to anybody who needs help, and we're going to do it in a way that, based on common sense, is going to be the most beneficial for them. So we can talk to people over the phone, we can talk to people in person, we've exchanged emails with people. Oftentimes, because of some of the smaller number of really crisis oriented interventions that we've done, a lot of people in the public identify us as just coming in person and mandating that people in the community be seen in a hospital environment. But at our core, we're a hospital diversion program. We are really trying to make people as comfortable in the community as they can be. We truly believe in an integrated model of keeping people in the community to be a part of their community and contribute to their community as much as possible without removing anyone if there's not a significant safety risk going on. Our ideal is that evaluations conclude with de-escalation, linkage to outpatient counseling, psychoeducation to family and the client about what they might be experiencing, and afterward just offering support through our hotline or something of that nature. So there's many options that people have if they ever feel that there's a chance that someone is going to harm themselves or harm someone else, or is so impaired by mental health symptoms that they really need counselors to reach out to them in some way and offer them support and a little bit of guidance. And we can do that in a number of ways. Occasionally, we do get requests that are geared exclusively towards chemical dependency or substance use, and we're always willing to have that conversation because there's a huge overlap between mental health concerns, substance use concerns, self-medication, and we always want to be talking to people about whether they're coping in ways that are healthy for them or that might be causing more unhealthy side effects than what's really good in the situation that they're facing. It's important that people who are requesting our services understand that at this point, we function under New York State's mental health hygiene law, and that law allows us to address any kind of apparent mental health symptoms that are going on with a lot of latitude, but it doesn't have any provisions for exclusive substance-based issues. So we cannot involuntarily mandate anyone to detox or rehab services. That really has to be a personal choice. And it does come with a lot of consequences for people's lives, a lot of physical consequences, emotional consequences, and we depend on people to have a conversation with us about what choices they have available to them, but we cannot make that choice for them.
Yeah, I know that's been a challenge for us as an agency, and understanding the role that you guys do play when it comes to the mental health and the mental health mental hygiene law, and how that doesn't cover over into the substance abuse chemical dependency uh, scope of service, if you will. So I think that that's a helpful point to highlight, so people don't get frustrated, when they try to maybe utilize us just strictly for a chemical dependency situation. But like you said, we're here to support, guide, give some connection or referrals out to our partner agencies that might be able to help a little bit more in depthly, with those types of situations. So have you seen anything kind of out of the ordinary for you guys in regards to the services with the COVID-19 experience going on? Is there anything that's been surprising or just kind of, different right now besides your remote setup and kind of operating in this way? Are you seeing anything different from the community at all?
There is an amazing consistency to the work that we do because our call volume, our visit rate, all of these factors have remained fairly stable throughout all of this. What we do see is a greater factor of stress and anxiety and uncertainty in our clientele, and to some degree in ourselves, because we're all experiencing a trying time. But for people with pre-existing mental health conditions, the stress of health risk, of employment insecurity, financial uncertainty, these things are possible triggers that cause other episodes of symptoms to flare up. And we're going to explicitly discuss how they can better manage that. But we also have no choice but to discuss the fact that we're dealing with a community pandemic situation, and that inherently does introduce a factor of increased fear for a lot of people in different ways. And we can relate to that and try to talk about how we could all manage that with different coping skills, supporting each other in different ways, and acknowledging that it has a domino effect on our emotional health no matter what.
Right, right. Yeah, it is. I think too, for us is the crisis center and the work that you guys are doing, and especially for you and your team, because you are still out in the community. It's just a different feel of how to manage your personal emotion while trying to fulfill the professional needs, in the role
Mhm.
that you're serving. So I know that's been a balancing act for you guys and your teammates and the agency at large. So I just want to thank you for that, because it is, you are a first responder in this work. And I know that these are, hard and unknown experiences for all of us as we've headed into this pandemic and the impact on the community. But it's really important for the community to know that this level of care that your department provides is up and running, it's operational, ultimately, because the work that you do is saving lives, for people who are really at high risk with their mental health experiences. So I think it's been interesting when I've been talking with a couple of the staff that the feeling that the community is being more open right now to talking about mental health because of this pandemic. So any kind of tips or guidance or message to the community that you want to share about, caring for your mental health at this time, or just anything else you'd want anybody to know?
Yeah, in general, on a community level, I would love to see an acceptance of the full range of reactions to this situation, because it's very easy for people to expect everyone to react the same way to the situation that they would, but we all react differently. We all have different factors in our lives that influence how much of a danger or threat we perceive in a situation. And generally, it's okay if this is not the most productive period in anyone's life. I think there's, in social media and from friends and family and colleagues, sometimes people perceive a pressure to capitalize on every situation and maintain their creative output, their professional output, their personal achievements. But this is a very difficult time.
Right.
And it's okay if you just need to relax, unwind in healthy ways, and accept that this may not be a period in your life when you can meet the standards of productivity that you've been held to previously. And I'm okay with that. I hope that other people can become comfortable and okay with that.
That is such an important message. I so appreciate the way you worded that and you stated that, because I do think that that is um, an area right now that the threat is its own thing, but then the pressures of the experience is another, and how we all manage that really is individualized, and to be okay with that and to honor yourself at this time while managing through this doesn't have to equal what everyone else around you is doing. So I think that's such a powerful way to kind of wrap up our time together. And I just want to thank you so much for everything that you're doing on behalf of our mission, the work that you and your teammates are doing to continue to keep our mental health safety a priority during this time. And so I, again, want to just thank Sarah, who's one of our mobile outreach counselors, for sharing a little bit of her experience behind the scenes at crisis services during the COVID-19 pandemic. And just a reminder that we're here. Our 24-hour hotline is 834-3131, and our addiction hotline is 831-7007. So thanks again, Sarah. It was so good to see you. You know, I really miss you guys being on site. This is such a different way of our operations, but it's really great to see you, and I'm glad you are doing well and feeling well. And really appreciate your time to kind of get our message out today. So thank you.
Thank you. We'll be back soon.